Have you ever experienced persistent itching on your body and just brushed it off as dry skin or an allergy? It's a common assumption, but did you know that persistent itching, especially as we age, can be a warning sign of something more serious? While itching is often dismissed as a minor issue, it can be indicative of underlying health conditions that, if ignored, could affect your overall health and longevity. In this video, we're going to dive into a common issue many seniors face: persistent itching. But we'll take a different approach, showing you that itching might be trying to tell you something about your body. It's time to listen to your body and consult a doctor if these symptoms persist. The first location we're going to look at is the lower legs, an area where persistent itching can often be linked to something more serious than dry skin. Persistent itching in the lower legs: what your body might be telling you. Many seniors experience itching on the lower legs, especially in the shin area, and think it's due to dry skin or irritation. However, if the itching persists, it could be a sign of circulation problems. As we age, our blood circulation naturally diminishes, and this can lead to a number of issues, including skin irritations caused by poor blood flow. One of the most common conditions linked to circulation problems is peripheral artery disease, PAD. PAD occurs when the arteries that supply blood to the legs become narrowed or blocked, which reduces blood flow to the area. This reduced circulation can cause itching, tingling, or even pain in the lower legs. Let's look at James, a 73-year-old man who began experiencing persistent itching on his lower legs. Initially, he thought it was just the dry air or irritation from his socks, but when it didn't go away, he sought medical advice. To his surprise, James was diagnosed with PAD. This condition, if left untreated, can lead to serious cardiovascular risks, including heart attacks or strokes. Key takeaway: if you experience persistent itching in the lower legs, it's important to consult with a healthcare provider. It could be linked to circulation problems like PAD, which requires early detection and proper care to prevent more severe health issues down the road. In this part, we've highlighted the potential risks associated with persistent itching in the lower legs and the importance of paying attention to these symptoms. But itching can occur in other areas of the body too, and each location could signal a different health concern. Stay tuned for part 2, where we'll dive into other key areas like the upper back, palms, and scalp, places where persistent itching may point to issues like nerve damage, liver dysfunction, or blood sugar imbalances. Stay with us for part 2 and make sure to like, comment, and share your thoughts on this important topic. Let us know if you've experienced persistent itching in these areas and what steps you've taken to address it. Stay tuned for more helpful insights coming your way in part 2. Have you ever experienced itching on your upper back, palms, or scalp and thought it was just a mild irritation? Many people do, but the truth is, persistent itching in certain areas of the body can be more than just skin deep. It could be an indicator of underlying health issues that, if ignored, might lead to more serious conditions. In part 1, we discussed the significance of persistent itching on the lower legs and how it can point to issues like poor circulation or peripheral artery disease, PAD. Now let's explore other common areas where persistent itching can signal something deeper, such as nerve damage, liver dysfunction, or blood sugar imbalances. We'll start by looking at itching on the upper back, where nerve issues might be lurking, and then move on to the palms, where liver health might be at risk, and finally the scalp, where blood sugar imbalances could be affecting you. Upper back itching, nerve damage, and spinal health. Persistent itching on the upper back is something that many people experience, but it's often dismissed as a simple skin irritation. However, if the itching is persistent and doesn't respond to typical treatments like lotions or antihistamines, it could be a sign of nerve damage. This type of itching is often associated with a condition called notalgia paresthetica. What is notalgia paresthetica? It's a condition caused by nerve compression in the spine, usually in the upper back. This compression can lead to sensations like itching, tingling, or even mild pain in the affected area. Notalgia paresthetica occurs when nerves that exit the spinal cord get compressed or pinched, causing discomfort in the upper back. If left untreated, this condition can worsen and lead to spinal degeneration, which could cause issues with mobility and overall quality of life. Let's look at Roger, a 68-year-old man who started experiencing persistent itching on his upper back. At first, he thought it was nothing more than skin dryness, but the itch didn't go away. Eventually, Roger went to the doctor, where he was diagnosed with notalgia paresthetica. With proper treatment and a plan to address his spinal health, Roger was able to manage his symptoms and prevent further complications. Key takeaway: if you're experiencing persistent itching on your upper back, especially if it's accompanied by a sensation of tingling or pain, it's important to get a spinal evaluation to rule out conditions like notalgia paresthetica. Early intervention can help prevent further nerve damage and preserve mobility. Palms itching, a sign of liver dysfunction. Another key area to watch out for is itching in the palms of your hands. While this might seem like a harmless irritation, it can sometimes point to liver dysfunction, particularly in the case of fatty liver disease. The liver is responsible for many vital functions in the body, and when it's not functioning properly, it can result in symptoms like persistent itching, especially on the palms and soles of the feet, scalp itching, blood sugar imbalances, and prediabetes. Have you ever had an itchy scalp that just wouldn't go away, even after washing your hair and using various shampoos? Scalp itching is often overlooked, but it can sometimes be linked to blood sugar imbalances, such as those seen in prediabetes or diabetes. High blood sugar levels can lead to changes in skin health, making it more prone to irritation, dryness, and itching. Why does high blood sugar cause scalp itching? Insulin resistance or uncontrolled blood sugar can lead to dry skin and inflammation, which can cause persistent itching. When blood sugar levels are high, the skin can become more susceptible to fungal infections like dandruff or seborrheic dermatitis, both of which can cause itching on the scalp. Managing blood sugar levels can significantly improve skin health and reduce symptoms like itching. Take Richard, a 72-year-old man who had been dealing with chronic scalp itching. Initially, he assumed it was dandruff or a reaction to his hair products. However, after seeing his doctor, Richard discovered that his scalp itching was linked to insulin resistance and prediabetes. By improving his diet, exercising regularly, and working with his healthcare provider to manage his blood sugar, Richard saw significant improvement in his scalp condition. Key takeaway: if you're experiencing persistent scalp itching, especially if it's accompanied by other symptoms like increased thirst or frequent urination, it may be a sign of blood sugar imbalances. Speak with your doctor about getting your blood sugar levels checked to rule out prediabetes or diabetes. Don't miss the final takeaways. Act on your symptoms for better health. In part, are you ready to take control of your health and address those persistent symptoms? In Part 1 and Part 2, we explored several areas of the body where persistent itching could signal serious health concerns, like circulation issues, nerve damage, liver dysfunction, and blood sugar imbalances. By now, you've learned that seemingly small symptoms, like itching on your lower legs, upper back, palms, and scalp, should not be ignored. In fact, they could be warning signs from your body, urging you to take action and seek medical advice before more serious conditions develop. In this final part, we'll emphasize the importance of recognizing these signs and taking proactive steps toward maintaining better health. We'll also discuss how you can stay empowered by being vigilant about your health and working closely with your healthcare provider to manage these symptoms. Persistent itching on the soles of your feet, a major red flag for nerve damage and poor circulation. Now let's turn our attention to the soles of your feet, another common area where seniors experience persistent itching. While it may seem like a harmless nuisance, itchy feet can be a warning sign of nerve damage or poor circulation. Conditions like diabetic neuropathy or poor circulation from heart disease or peripheral artery disease, PAD, can cause itchy sensations in the feet, often coupled with other symptoms such as tingling, numbness, or pain. As we age, our blood flow decreases and nerve function can become compromised, especially if we have chronic conditions like diabetes or vascular disease. Ignoring itchy feet can lead to more serious complications, like open sores, ulcers, or infections, especially if circulation is poor. Let's look at Frank, a 75-year-old man who had been dealing with chronic itching on the soles of his feet for several months. At first, Frank thought it was just a mild irritation, but after the itching persisted, he consulted his doctor. It turned out that his blood sugar levels were not well controlled, leading to early-stage diabetic neuropathy. By adjusting his diet, taking prescribed medication, and practicing better foot care, Frank was able to prevent the condition from worsening and regain control over his health. Key takeaway: if you experience persistent itching on the soles of your feet, especially if accompanied by tingling or numbness, it could indicate nerve damage or poor circulation. Consult your healthcare provider for a thorough checkup to address these issues early and prevent further complications. Taking action. Be proactive and vigilant about your health. Now that we've gone over the key areas where persistent itching may signal serious health concerns, it's important to remember that early intervention is critical. The longer you wait to address symptoms, the more difficult it can be to manage underlying health issues. By paying attention to your body and acting promptly, you can prevent complications and enhance your quality of life. Here are some proactive steps you can take. Consult with your doctor. If you experience persistent itching in any part of your body, especially in areas like the lower legs, upper back, palms, scalp, or feet, schedule an appointment with your healthcare provider. They can run tests, diagnose the issue, and create a treatment plan tailored to your needs. Lifestyle changes. Based on your doctor's recommendations, consider making lifestyle adjustments such as improving your diet, increasing physical activity, and managing chronic conditions like diabetes or heart disease. Self-care. Pay attention to your body's signals, practice good hygiene, and stay consistent with any recommended treatments to help manage itching and related symptoms. Stay informed. Knowledge is power. Keep yourself informed about potential health risks and educate yourself about the early signs of common conditions like PAD, neuropathy, liver disease, and diabetes. The power of community and support. Remember, you're not alone on this journey. Whether it's talking to a loved one, joining a health support group, or engaging with your healthcare team, community support can play a crucial role in maintaining your health. Sharing your experiences with others who may be going through similar issues can provide valuable insights